Okay, so good morning and thanks for coming to listen to my talk. While I talk, if you have any questions, please feel free to ask. And but if the time finished, ask me to stop, shut up as well. Okay, I have few slides, but hopefully not too many. Okay, so I'm going to speak about mathematical oncology. Some of you know about mathematical oncology. So how can I use mathematical and computational techniques to study cancer? The processes involved in cancer. Eventually, how can I use that to later study treatments and help in a clinical scenarios and so on. So this is an image of a spheroid cracked open, and the colors represents the concentration of oxygen. So you can see that outside is brighter, more oxygen, and as it goes inside, the oxygen distribution is going lower and lower and lower, which is quite important factor when we talk about therapies. Okay, so there are different ways to study or model tumor or cancer. So one can use partial differential equations. So the first set of pictures are modeled by using one single mathematical equation called partial differential equation, which is used to study the growth of brain tumor, gliomas. Gliomas they are one of the nasty cancer, and the survival rate is around 12 months or so after detection. So the first mode of treatment is usually a surgery, if they can, then a combination of radiation or chemo. So we did that using one simple mathematical equations. Then the other box represents a much more complex way of modeling tumor, which called hybrid multi-scale models, where we can look into each cell, how each cell grows, and try to get a little more information into the cells, what is happening within the cell, and how can we target it using different drugs and so on. I'll speak a little bit more on that. I'll try to reduce mathematics in it. It's just to give an idea what we are doing. So why we are doing it? So in the current clinical practice, it's mostly we call it class solution to individual problems, right? We have a lot of money spent on cancer treatments, and most of the times the patients with even a particular type of cancer are given a uniform treatment scenarios. For example, somebody is coming with a ovarian cancer or a particular type of cancer. Even with individual variations, they are often given similar type of combination of the treatments, and most of the times similar drugs and dosage, right? So for example, I have 5 patients in here, and if they are given a uniform treatment, which is the red curve, and you can see that some of those patients are overtreated and some of these patients are undertreated, which increases the complications after such treatments, which will cause much more to treat those complications. So the idea is to how can we use mathematical approaches? Can we use mathematical approaches or computational or visualization approaches to use the information that we already have from the patients? For example, each patients go through different diagnosis, right? They take biopsies, they take MRI, they take CT scan. The wealth of information is all those data. Can we use this data, and can we devise kind of patient-specific treatment protocol, at least advice for this patient, this is the best treatment protocol. So you should give chemotherapy first, radiation after. The dosage should be roughly, say, 60 gray of radiation, or the chemotherapy dosage is such, and so on. Can we do that in a mathematical point of view? So now AI and data science is much more used in clinics, and together with modeling, it can inform such treatments to get a better outcome. So the main idea of my research is, can I give from class solution to individual problem? Can I give an individual solution to individual problem? Can I make the treatments patient specific? So, and modeling can also help in clinical trial designs. It can predict optimal drug dosing and even drug discovery. For example, at the moment, we are working with AstraZeneca to study one of the chemotherapy drugs that they are developing to target DNA damage response pathways. So they are interested, I mean, they do have a modeling team in there, but they are interested in studying the spatial dynamics of cancer, how things grow around, rather than just the efficacy and pharmacodynamics modeling. So why we use, so at the moment we are trying to develop multi-scale approaches. Why? Because cancer is a multi-scale disease. So there are things changes within the cell, different proteins levels are expressed, different pathways are affected. And then it is also affected by how the cells interact together, or cells interact with where they grow. For example, whether they have enough nutrients, whether they have enough food to grow, and then it will trigger other things like they recruit blood vessels called angiogenesis and so on. There's a complex structure in there. So, and later, in a big picture, diagnostic point of view, how then it can inform the diagnosis and treatments and so on. So it's a multi-scale approach. So just to give a brief idea what we are doing, so we do consider cells. So for example, this is a cell. Each cell has its own internal processes. For example, we can include cell cycle dynamics. So cells go through a cell cycle to grow. It's like the growth cycle. And then at some point, say, I have enough growth, I will divide. So we can include those things into the mathematical model. So these are included by using equations. So for example, I have cell cycle, and we can say that at some point the cell divides and give two cells. So we can take that growth into account. Then I can study what happens if I give a specific drug that targets the cell cycle. So I have a drug that targets the growth or stops the cell cycle, and how then it impacts the overall growth of the tumor. Right? The mathematical model have predictive power rather than just analyzing the data. Then how each cells interacts together, and how, for example, cancer grows in a normal tissue. So I'll show you a video in a minute. So these are mainly modeled by using mathematical equations. So for example, this is we use such equations to model cell cycle within a cell. Then we have partial differential equations to study oxygen dynamics, drug dynamics, and so on. But I don't want to go too much into great details, but I'm happy to explain this. Then we can include, so why we are studying growth. So once we have a growth that is calibrated, we can study treatments, right? If you are having, if you can study the growth of a specific cell type, then I can study what is the best treatment to control the growth. So such as radiation, chemotherapy, and so on. And we can put all these things together in nice modeling techniques, such as cellular automata or cellular post model, to get meaningful outcomes. So one example is, we've been doing a few projects together. So I work with Institute of Cancer Research, London. So our models are calibrated and validated for in vitro scenarios. So when cells are grown in a petri dish, we can predict those growth and treatment outcomes. So the parameters are calibrated for in vitro scenarios, not for what is happening in a mouse or patients yet, because of the scale at which we are talking about is bigger scale. So this is a project done by Dr. Sarah Hamis. She graduated 2 years back, now working as a postdoc in Finland. So this is to study the effect of we call something called hypoxia activated prodrug. It's one of the drug. It's like a Trojan horse. So the drugs are toxins. So we need to minimize the toxins to the normal places, the normal tissue. So these drugs are kind of Trojan horses. They go to the places where there is less oxygen. For example, in most of the times in the cancer, you have a less oxygenated area inside. So it goes to the places where there are less oxygen, and then that triggers or that opens up these hypoxia activated prodrug, releases the toxins and kill the cells. So that's the idea. So this is a model that we created to study that, and this is the set of images from experiments, and this is kind of similar calibrated model, mathematical model. And I just want to show you how this models evolves over time. The inside bar shows the places where you have less oxygen, and in this case, the outside bar shows the cases where the cells are growing, right? So cells need enough oxygen and nutrients to grow. So the cells grow only outside. So this is usually so this is another movie which shows, how can we model in a 3D scenario. So for example, I can consider blood vessels. So these are, kind of animation, not animation, we can consider blood vessels from where oxygen is supplied, and in that heterogeneous environment, how cancers grows, right? So the picture that you show in the first slide is a cross section of such spheroid. And again, a different scenario where, I planted a cancer cells inside inside a tumor tissue and how it grows over time. So what I assumed is normal cells can only grow outside when there is enough space, but cancer cells can grow everywhere, regardless of the space. They multiply. So that's the difference between cancer and normal cells. Normal cells only grow when it is needed. For example, wound healing. When there is a wound, the cell proliferate to fill the wounds. But the cancer cells doesn't have that mechanism to stop anything. It just keep multiplying, growing bigger and bigger and bigger. Okay, and why we are doing it? So such models can help in drug discovery, for example. So one example is we are working with AstraZeneca to study DNA damage response pathways. So it is cost effective and easier and faster than any normal experiments, right? So the idea is once the model is calibrated, for example, this is a mathematical model, and this is coming from experimental results. So we won't get exact same thing, but we can get qualitative predictions on what is happening. So once we have a calibrated growth model, then we can give various treatments and try to select the options that they need to take for experimental testing. So it reduces the wastage, it reduces the economic cost of developing a drug. Just to give a visualize what I mean by drug discovery. For example, if one of the path is implicated in cancer growth, for example, just showing a picture from the internet. So say that this is a growth factor, so something is binding to the cells, and then it triggers cell survival, apoptosis means cell cancers, death, and so on. Then one obvious question people can ask is, what happens if I stop something there? Can I target that particular protein or cells, the pathway or that particular steps in that pathway? So it's really hard to do experimentally, but once you have a mathematical model, we can easily test out hypothetical situations and say that, if I stop this, what eventually happen at the end? Will it change something at the end qualitatively or not? So this can inform drug discovery and so on. So another example is how to combine different therapies. For example, most of the cancer treatments are given a combination of chemotherapy, radiation, and surgery. What is the best way to combine them? Should I give radiation first, chemo second, or should I give chemo first or radiation second, and so on? It's not, the answer is not quite obvious. It depends on the cancer, it depends on the type of the cancer, and it also depends on the location, and so on. So we can use, once we have a carefully developed mathematical model, we can study those things, which of these things will give you a better outcome. Yeah, I think I will keep going. So the idea is, just to give the framework by which we can develop such models are, for example, you look at the MRI or CT scan. From that, you can try to get the location where the tumor grows, and then we can try to develop mathematical models which can be used to predict various treatment outcomes. So just to put it out there, the vision is e-health at some point. We are not quite there yet. The idea is, can we use patient data, diagnostic data, and treatment protocols? You extract such data and put that into mathematical or computational modeling, AI, machine learning, all those keywords. Then eventually, can we get something like optimum treatment scheduling or possible predictions? And can I tell a patient after a particular treatment, you should come back for a diagnosis or testing after, say, 6 months? So can I give that time frame by which they should come back for a test? Saying that, using modeling approaches. The final slide. So the idea is towards a better healthcare using computational approaches. Treatment delivery and planning. It can be used for clinical trial designs. People are using at the moment. There are clinical trials planned by using mathematical equations. I know a case in Moffitt Cancer Institute in Tampa where they use mathematical equations inform clinical trials. So they select patients based on that. So investigations of multiple effects of the therapies and can be predicted, predicts what's going to happen after each treatment and what is the best way to treat patients. Okay, I'll stop there. And if you have any questions, please feel free to ask. Thank you.